Our feet can provide important clues as to what's going on in our bodies, so we need to pay attention to what they're trying to tell us. Swelling from fluid buildup might mean heart or kidney issues, and sores that won't heal can be seen in diabetes. And you can't afford to tiptoe around these symptoms and problems. Dr. Frida Lewis Hall, the Chief Medical Officer of Pfizer, joins us once again.
You know, I'm always happy to be here. There is something I want everybody to know, and that is people with diabetes are twice as likely to have problems with their feet, and they can go on to develop nerve damage. Now, one form of this nerve damage we call diabetic peripheral neuropathy. I know that's a mouthful for everybody, so we shorten it to DPN. And if you have DPN, you can go on to develop foot ulcers and ultimately may even lose that foot. So it's really important if you have things like tingling in your feet or burning in your feet or sharp stabbing pains or have numbness, or some people say they can't even feel their feet at all, they may be warning signs for nerve damage. 60 to 70% of people with diabetes actually have some form of nerve damage or what we call neuropathy.
That's a high percentage. And if you look at this foot, does it frighten you? A little bit, right? It should. Because poor blood flow is another problem that can impact the feet. And I'm going to show how it happens, because instead of healthy blood flow to your feet, so normally blood flows no problem down to your feet, right? Pretend this is an artery taking blood to your foot. With diabetes and high cholesterol, fat and cholesterol deposits in the arteries prevent good blood flow. You see that? So if this is your foot, you're not getting good blood flow. That's called peripheral vascular disease, and it makes it harder for your body to heal from injuries and fight off even seemingly minor skin infections.
That's so true. Not everybody that has nerve damage related to diabetes has problems with blood flow, but you can imagine if those two things get together, it spells trouble for your feet. So it's really important to understand the challenges of having diabetes, because in the U.S., 60% of all lower limb amputations are related to diabetes. 60%.
Why do amputations occur? Well, we talked about diabetes, and what can happen in a diabetic patient is you can get a cut on your foot and not even necessarily know it's there. So you don't know whether or not to treat it or not because you don't even know it's there. That can lead to an infection. But with diabetes, you have a compromised immune system. So that local infection can very quickly spread and it can become gangrenous. And in order to save your life, you actually have to amputate at the site of that infection. And that's why diabetics experience so many amputations.
Exactly, and I just wanted to make sure that we remember that in African Americans, the likelihood of a lower limb amputation is three times the risk. So what can we do to avoid that? First of all, inspect your feet. Look at them. Second of all, make sure that every time your feet become wet, you get them absolutely dry. And last, I know it can be a little difficult, make sure that your shoes are always comfortable and a good fit.
Can I see your shoes?
Yes.
Frida, those are beautiful shoes. Are they comfortable?
Well, these are perfectly comfortable sitting shoes.
I love it. And you know, the best way to lower your foot fear factor, keep your diabetes in check, keep your blood sugar stable, control things like your blood pressure, reduce cholesterol, stop smoking. That makes that blood flow I showed earlier much worse.
And make sure that you get regular examinations of your feet. And anything, no matter how small, that's going on with your feet, you go to tell your doctor about. And your doctor may also want to see how much feeling you have in your feet, and would do a test with something that looks like this. This is called a monofilament. The thread is very small, it's about the size of fishing wire. Your doctor's going to ask you to turn your head, and then is going to touch your foot in just a few places and ask you whether or not you feel it. Only takes a few minutes, and I promise you, it does not hurt. Now, there's so much to know about foot health. If you want more information, go to gethealthystayhealthy.com.
And you can also visit thedoctorstv.com. Dr. Lewis Hall, thank you. As always, we'll be right back.